Hello, this is Dr. David Green, Education Director for Premier Pain Specialists in Chicago. Today's topic is what you need to know about peripheral and diabetic neuropathy. 20 million people in the U.S. suffer from diabetic neuropathy, and another 20 million people suffer from the other types of peripheral neuropathy. Neuropathy overall involves damage to nerves that are outside the brain and spinal cord. There are three types. The first is mononeuropathy, and a great example of that is carpal tunnel syndrome, where you have one nerve involvement. Polyneuropathy is where you have several nerves involved. A good example is diabetic neuropathy. And then mononeuritis multiplex is when two or more nerves are involved in different areas of the body. Best example of that is Lyme disease. So what are the causes? There are a ton of them. The most common cause by far is diabetic issues, and that's more common than all the others combined. Secondly, you have alcohol intake, possibly chronic kidney issues, liver infections, vitamin deficiencies, and you see how the list goes on with heavy metals, possibly after chemo or radiation. Tumors can cause neuropathy, and then amyloidosis and thyroid. So the symptoms are going to vary between patients from mild to extremely disabling. Usually both lower extremities or arms are involved. Early on, patients can experience tingling sensations, burning sensation, or pins and needles sensation. In the moderate to severe, it can actually get worse to more severe burning or even a searing type of pain. End-stage sensation is lost altogether. It can make a patient very weak or unstable with walking, possibly have dexterity issues. And then later on, there can be organ dysfunction with the bladder, cardiac, or kidneys. Treatments for neuropathy, the main treatment overall is to control the blood sugar if it's diabetic or whatever the other inciting issue is. Stop the drinking of alcohol or stop the heavy metal toxicity. And then there are some medications. It can be over-the-counter, such as anti-inflammatories and Tylenol. Opiates can help. Neurontin or Lyrica can help modulate the nerve-type pain being experienced. And then topical pain creams can be very helpful. Physical therapy, chiropractic treatment, TENS units, such as you see here, which are about the size of an iPod, battery powered, and they have these foam pads that have electrodes going through them that can alter the way the brain perceives those pain signals. And there can also be injections if there is specific nerve compression involvement. A spinal cord stimulator implant has been revolutionary for various types of neuropathy. Studies show over 80% pain relief, actually over 85% improved sensation, and 58% of patients actually had their sensory deficits reversed completely, which is amazing. It's an outpatient procedure, it's relatively low risk, and it can provide long-term benefits. The Dell decompression procedure is an outpatient procedure that can be helpful as well. So what are the outcomes for neuropathy treatment? Well, it can be hard to completely reverse the neuropathy, but it can often be controlled. With the variety of non-operative treatments, the vast majority of patients are able to achieve a dramatically reduced level of baseline pain. And this allows individuals to increase their activity along with avoiding any surgery. The top non-operative pain management in the greater Chicago area is with Premier Pain Specialists. There are several clinics in and around the city, accepting over 50 insurances and providing over 25 different treatment options. Over 90% success rates are seen overall with the board-certified award-winning providers. If you or a loved one is suffering from any of types of neuropathy, please visit us online at ppschicago.com and then call us for more information and scheduling at 847-220-7907. Thank you very much for watching.